The next topic we are going to look at is exercise prescription for cancer. The learning outcomes of this presentation would be at the end of the session, you will be able to discuss the effects of exercise on cancer pathology, list out the methods of pre-participation screening for patients with cancer, and write an exercise prescription for cancer patients following the necessary guidelines. So, what is cancer? It is an uncontrolled abnormal growth and proliferation of cells, which in some cases can spread to distant anatomical sites. So, as an overview, I would like to brief you regarding the treatment options available for cancer. So, the major options would be surgery, radiotherapy, chemotherapy, and immunotherapy. So, the goals of exercise therapy on cancer. So, one of the lifestyle modification we can suggest for a patient who has recovered from a cancer is exercise therapy. So, exercise makes them better in a lot more ways. So, it requires thorough understanding of the past and current medical history, treatment options given to them, medication, signs and symptoms, and the functional capacity and the comorbid conditions. So, what are the effects on exercise response? So, effect of tumors on exercise response directly related to the tissues affected and the extent of involvement. So, easy fatigability and exercise intolerance are common features. So, because of them, it is little difficult to make them exercise. Accordingly, the intensity has to be made. The side effects of anti-cancer therapy also affects the exercise response. So, in some cases, amputations may be one of the treatment options for cancer. So, the amputations can result in permanent disability. Again, making them exercise is a greatest difficulty. Radiation and chemotherapy can cause permanent scar formation in the joints and lungs. So, this can reduce their exercise tolerance, and also the joint stiffness can make their mobility less. What are the effects of exercise training? Exercise training is safe and beneficial for most of the cancer patients. For those undergoing therapy for cancer, the objectives of exercise training would be to maintain the strength, endurance, and the level of function. And for cancer survivors, the key objective of exercise training would be to make them return back to their former level of physical and psychological function. So, coming on to the exercise testing for the cancer patients. So, like other chronic disorders, we have to test them in terms of four criteria. Number one is the endurance. So, based on the endurance test, we are going to give their exercise aerobic exercise. So, for this, we can make them do a cycle incremental test. So, using a ramp protocol with a stage or increment with up to 25 to 50 watts per 3-minute stages, or we can use the treadmill incremental test with 1 to 2 minutes increase per 3-minute stages. So, what are the measures we look at during this exercise testing? A 12 leaded ECG and heart rate, blood pressure, the rate pressure product, and the rate of perceived exertion on a scale of 6 to 20, and maybe very rarely we go for gas analysis as well. So, what are the endpoints of this testing? So, what we are looking at? So, we are looking at a serious dysrhythmias and more than 2 millimeter elevation in the ST segment or depression. Or we also look at a parameter called ischemic threshold, the exercise intensity at which the ischemic changes starts appearing. So, that exercise intensity we have to note down. And then T wave inversion and maybe undue increase in the systolic and the diastolic blood pressure. The strength can be assessed using free weights, machine weights, or handheld dynamometer. So, we can look at a measure called as 1 repetition maximum, and the pain and fatigue are the endpoints of this testing. So, it is helpful in deciding the exercise intensity for the resistance exercise. So, flexibility can be assessed by goniometer and the sit and reach test. So, the angle of flexion and extension at various joints can be assessed. The functional test can be performed to assess their functional capacity, like sit to stand test or the stair climbing test. So, useful in determining the level of assistance required for these patients. The neuromuscular assessment include gait analysis and balance. So, this is used to determine the level of assistance required. So, what are the special considerations for the exercise testing? So always assess for adverse, acute, chronic and late effects of cancer treatment. Evaluate other comorbid conditions as well that may influence ability and safety to exercise. Consider how cancer and its treatment options may affect the balance, agility, speed, flexibility, and modify and interpret the fitness test accordingly. Consider relative and absolute contraindications to exercise testing. So, moving on to the very important part of the presentation, the exercise prescription for the cancer patients. So, like for other chronic disorders, we are going to follow the American College of Sports Medicine guidelines. So, we have to give them aerobic activities which employs large muscle group like walking, cycling, and swimming. The goal of this exercise program is to increase the work capacity to control the body weight, improve the mood status, reduce the fatigue, and improve the quality of life. So, always we know for cancer patients, the quality of life will be compromised. So, one of the goals of exercise therapy is to improve the quality of life. The intensity can be symptom limited and we have to monitor the dyspnea, and 1 to 2 sessions 3 to 5 days per week would be ideal. Strength training can be given using free weights or isokinetic mission. So the goal of strength training is to improve the strength in the various parts of the body to increase the lean body mass, and again it is symptom limited. Flexibility can be given by a lot of stretching exercises to increase the range of motion and to decrease the stiffness which is arising out of the cancer therapy. 3 days per week would be very ideal. The functional therapy can be given to address the functional needs, to simulate their daily activity, improve the gait, maintain as much independence as possible on a daily basis. So, what are the special considerations for the exercise programming? So, always assess the client's current medical condition, functional ability, and general health before each exercise session, and always keep in mind the absolute and relative contraindications to exercise. So, as assessed by the physical activity readiness questionnaire. Develop an exercise program to accommodate to the changes from the cancer and its treatment. Recognize when to refer the clients back to their physician for evaluation of the new or worsening symptoms, and also be aware of the warning signs, and know the cancer specific emergencies and assess the risk for adverse late effects of the treatment that could increase risk associated with the exercise. So these are the special considerations we have to have in mind when we are dealing with a cancer patient. So the summary of this presentation is, we discussed what is the effect of exercise therapy on cancer pathology. We also discussed the various exercise testing protocols for a cancer patient and how we can come up with an exercise program for the same. So here, lastly, we are looking at a case study. A 57-year-old male with stage 3 colonic cancer received surgical adjuvant chemotherapy, and he complained of feeling tiredness, weak and worsening numbness in his feet and fingers, and had a poor appetite. He wanted to get strong enough to resume playing golf, and he requested guidance in setting up an exercise program. So as we saw before, so this exercise program is going to make him better and he is going to resume back whatever he was doing before. So this would be the main goal of the program. So as advised, we have to test them for all the 4 categories like endurance, strength, flexibility and the neuromuscular assessment, and start with an exercise program involving a moderate activity, and the progression can be made as depending upon the results. Thank you.